Hello, everyone. Today, I have the opportunity to interview somebody who is closely related to one of the most vulnerable populations during this pandemic, namely the senior citizens. Mr. Philip Beltz is the director of the Council of Aging here in Winchester, Massachusetts, as well as the director of the Jenks Center. Now, without further ado, Mr. Philip Beltz, could you please provide a brief introduction about yourself?
Certainly. I'm the director of the Council on Aging, which is a municipal agency. They exist throughout the Commonwealth of Massachusetts, where municipalities receive a formula grant from the state based on the number of seniors that are 60 and over. And the state provides a dollar figure for this year that we just finished in 2020, June. It was $12 a head, and it's based on the most recent census data, which goes back to 2010. So in Winchester, that number was like close to 5,000 seniors in 2010. In addition, I'm the director of the Jenks Center. The Jenks Center is the senior center. It's the only senior center in the Commonwealth that is privately owned. The Winchester Senior Association Trust, they own the building, and the Winchester Seniors Association is a nonprofit entity that provides services and programs here at the Jenks and manages the Jenks Center and has a staff of about 6 employees. The Council on Aging is responsible primarily for strategic planning to meet the needs of seniors, as well as provide direct services. We have a nurse, we have a social worker, we have a transportation coordinator with a van to provide direct services to seniors in Winchester.
All right. Now, would you mind elaborating on the COVID services that you guys offer and how citizens, namely senior citizens, could access them?
Okay, seniors are invited to call us anytime they have any questions. Our number is 781-721-7136, and you can also look at the Jenks Center website to see some of the program services we have available. The center actually closed after Friday, March 13th. That was the last day that we remained open, and we had already witnessed a very slow patronage at that point of the center. And what we did was we sort of revamped our service model and directed our services to really help people primarily with needs of grocery shopping, as well as helping people financial assistance. So we received a grant through the United Way for $5,000 for food gift cards. So we did shopping for about 20 seniors that we did shopping every week, where we would go to the local Stop and Shop, do shopping, drop off, call, get their list, pick it up. We had several members in the community that we mailed gift cards to. We worked with the Winchester School of Chinese Culture, and they identified people in the community without sufficient incomes, and we provided them, along with the faith-based community, in identifying people that were in need of assistance. In addition, we've continued the work we've done with providing transportation as necessary for any urgent medical appointments. All medical appointments were basically discontinued unless they had some sense of urgency, but we did provide assistance with that. We provide medical equipment loans to anyone in the community, and that was a big part of what we did as well when people were discharged from hospitals. And foremost, we identified about 150 people in the community that were vulnerable and at risk. They lived alone. They didn't have any really close, strong family support systems. And what we did was we offered telephone reassurance. So these individuals would get telephone calls from us. All of the staff here, including myself, would contact individuals and just check in on them to see how they were doing.
Right. So I actually now have a two-parter. Is there an expected reopening date of the Jenks Center? And secondly, for people who did not have a family that was living near them in Winchester, perhaps they lived in a completely different state. Was there a specific home that was provided to them through the Jenks Center where they could stay for the time being?
Well, the center is not equipped with cots or any type of emergency services. So, in answer to that question, no, there was really not any way that we could, but we did provide service linkages for other institutions that could help. We worked with Metro West Housing Partnership for people that had housing issues of, in need of some kind of emergency housing.
Right. That's
Okay,
okay.
as far as the center opening, we've been working very closely with the Board of Health. And because there are three boards of directors that are present at the Jenks Center, we're working through to try to develop a plan of community benchmarks that we want to see achieved that would enable us to open. We are, well prepared and have been informed by the health department that we have a lot of things in place that we could have a very modified, slow reopening. But this would not include what most people are accustomed to. The biggest aspect of the Jenks, I think, as far as what it provides the senior community, we have eating programs, we have transportation, we have blood pressure clinics, we provide hearing screenings, that sort of medical, social services. But what seniors benefit most from, and what has probably impacted them most with COVID, is the inability to socialize.
Right.
And it's proven scientifically that seniors that don't have the opportunity to socialize generally have diminished outcomes because not having that social contact is really of prime importance. So the Jenks Center has a cafe. We have tables outside, inside, where people would come in and just have a cup of coffee, a pastry, sit down and talk. And we don't see that in the near future when we do reopen. We would like to say that we're going to reopen sometime in the near future. It's hard to say, exactly when. It could be in a month, maybe 2 months. We're trying to see how we could make that happen. But because of the current mandate by the governor and the Board of Health, technically we're only allowed to have 25 people in the building. And
Right.
even though the building is quite large and it's on 3 levels, that still constrains our ability to offer different programs and services. But we are going to open with a smaller menu of opportunities, but we won't be able to have services that would allow people to sit down, have coffee, because that wouldn't really be appropriate this time.
Sure, sure. Um, and could you, I know that you previously mentioned that there are some benchmarks that you guys have to reach in order to slowly reopen the Jenks Center. Could you please elaborate on what some of them are?
Well, I mean, one is that we're watching, and I think in a positive sense, we're seeing that the positive rate, the average for the state continues to decline. And we would like to see something, it's now at like 1%, and something that would be consistent at that level. We would want to see the absence or a very low presence of COVID identification in Winchester, and Winchester's been lucky at this point that the numbers have been. We'd like to see with the schools, if they open or not open, and also within this community, there are many colleges, to see what are the consequences of these facilities that are reopening, to see whether there are any surges, because seniors being so vulnerable, we wouldn't want to open and then suddenly have to retract what we were doing. So we just want to ensure safety. When we do open, we will mandate that everyone wears masks while they're in the building. It will meet the governor's guidelines by having a minimum number of people here. We'll stagger the programs. And, we'll just make sure that we do everything. We've already ordered specialized sanitizing equipment. So everything will be cleaned between programs, and just to ensure that we're promoting the safety of seniors in the building.
Right. Now, I know that you mentioned how the communication factor for senior citizens is an important thing, but other than that, are there any other challenges that senior citizens face during this time that others may not?
Well, I had mentioned the isolation and how difficult
Right,
it is for
right,
seniors being isolated. And, also there's a strong reliance on people that are neighbors, family members that, to help them somewhat integrate. I think because of their vulnerability medically, they are faced with sort of a self-imposed restriction of not even seeing family members. And that's very difficult to, not have that ability. And for many people, the way the senior center model exists is people retire, they join their local senior center, and it really becomes a major hub of their existence. So by this not being there, it removes education, it removes culture, arts, it removes socialization. There are a lot of aspects of the Jenks and the senior center that are very integral to a senior's average living experience, and it means a lot to them not to have this available.
right. Now, how has the pandemic affected the way that your department has been working? So, what are the challenges and what are the differences that you guys have been making to your department to adjust to COVID?
Well, we've definitely sort of ramped up our assistance of what we can do medically. So, the nurse does make visits to people in their homes, and the social worker has been reaching out to ensure that certain individuals, and she works with not just seniors, but everyone in town. And some people have been impacted because of COVID, losing their jobs and having financial resources and ability to pay rent. That's been something that, has been an additional factor due to COVID. And, you have to understand that many of the people that are seniors that have been most impacted by COVID, as far as, in particular death, are those that are in long-term care facilities. So some of these people are individuals that we knew that came to the center before they ended up, going into a long-term care facility. And that's something that has had an impact. And, the fact that we're doing more work by telephone than we've ever done before, because we're trying to see how we can reach as many people as we can. And, despite these limitations, we're doing everything we can to continue to improve the outcomes of older adults in town. An example is we're doing a lot of programs on Zoom, virtual programs. We're doing programs outside, exercise classes, Tai Chi. So that's required an adaptation to do things slightly different. And then we've also tried to be creative, and later today, we're having an ice cream drive-by. It was supposed to be an ice cream social, but it's going to be more like ice cream antisocial, because people stay in their cars and
Right.
staff are going to hand people ice cream cups and a little bag of resources and face masks.
Yeah.
And we should see several hundred people here today, and we're looking forward to that. And we have a drive-by shredding event coming up in the end of September, where seniors will be able to come by with materials that need to be shredded, and we'll just take the items from them and do the shredding for them. And I might add that this was generously Stop and Shop assisted our efforts with the ice cream sundaes, and Winchester Hospital has supported community efforts with the ice cream social, as well as with the drive-by shredding.
That's fantastic to hear. And it's great that where you guys are finding ways to help the senior citizens, though this pandemic has been so in, somewhat hard to deal with, let's put it that way.
Right. And one thing that we're looking to do in the near future, which hopefully might involve you as well and your peers, is that we're developing a intergenerational program. The Council on Aging received a grant from the Cummings Foundation to foster cultural competency in the town of Winchester. So we're working with the Winchester School of Chinese Culture, and they're going to be offering ESL classes for older Chinese-speaking adults and American citizenship classes. And in addition, we partnered with a consultant where we're going to have intergenerational programming. And we're going to be working with all the Winchester schools, along with Winchester nonprofits, including the Jenks Center, to develop intergenerational programs, to develop bonds between generations where younger students can learn from older adults and vice versa, to work together and build bridges of generations.
Right, right. Now, do you have access to resources that is specifically dedicated to the aging population at either a state or national level? Or, and if yes, how, what are they and how do you utilize them?
Well, we do receive, and our largest funding comes from the Massachusetts Office of Elder Affairs, and that's a formula grant that we receive annually to help us with direct services to Winchester seniors. The Winchester Seniors Association, they are a nonprofit, and they actively fundraise. And most of the programs, virtually all, but most of the programs we offer here at the Jenks are free of charge. So that way we don't, seniors don't pay. We have over 2,000 members. About 70% of them are Winchester residents. The remaining are in neighboring communities, but we don't charge for services. And that way we try to develop an eclectic menu of programs and activities that appeals to many people. When you had asked earlier about a major change because of COVID, we definitely have limited programs. We used to have 7 language classes here. We have art classes. We have, so many different activities, educational programs, and, 7 different exercise programs. So all of this has been scaled back because the center currently is not open to the public, and we're just adapting as best as we can.
Sure, sure. All right. Now, other than the things that you've previously mentioned, do you recommend any lifestyle changes for any senior citizens that may be watching this, or do you just recommend anything that they should be doing differently at this time?
Well, I think everyone has to, practice caution. So, if you're with people that you've been with in your household, you still should be cautious. And because if people go outside, it's like imperative that everyone wear masks, that people wear gloves, people continue with, the appropriate cleaning, sanitizing, everything imaginable. And you want to always err on the side of anyone could be contagious, so you want to make sure that you protect yourself.
Right, right. And finally, do you have any parting thoughts that you'd like to add?
Well, I just would like to add that I appreciate your efforts. I think it's really extraordinary that a young man would broaden his horizon and perspective, include others, and try to provide information and communication, because that's essential for all of us to learn from each other. And I commend you for your efforts.
Thank you so much. I truly appreciate that.
You're welcome. Thank you.
Yeah. Well, okay.